Good evening, everyone. So, I welcome you to the third episode for Evrox Healthcare COVID Chaos of COVID Chaos. Behind the scenes. So, initially, in the first two episodes, we have spoken about our experiences regarding the COVID 19 virus, the vaccines, as well as the experience of the patients undergoing the COVID treatment or who have got the COVID 19 disease. So today we will take you to behind the scenes where we discuss the unspoken, unheard heroism of the frontline workers or healthcare workers and administrators and the immense workload they go through to ensure people get treatment. You might appreciate them, you might not, you criticize them, but you can never ignore them in your lifetime. So today from Evrox Healthcare, I welcome you all to the third and the final episode of COVID Chaos. Evrox Healthcare, to speak about it, is a Evrox Healthcare is a MCI compliant digital platform. It enables service providers to give teleconsultation and telemedicine services. Doctors, psychologists, therapists, yoga teachers, fitness experts, nutritionists, pranic healers, and many more, all wellness related services are provided on this platform. The platform right now is in its beta phase and will be publicly available within 2 weeks. In our panel today, we have very eminent three people whom we will discuss the behind the scenes COVID chaos pandemic with. Our first speaker is Dr. Aniruddha Dam, a pioneer in the field of head and neck oncosurgery with almost 25 years of experience in head and neck oncosurgery. He heads the Department of ENT of Chittaranjan National Cancer Institute. Sir has several research papers regarding the head and neck oncosurgery with his favorite field that covers laryngectomies, the salivary gland tumors that Sir loves to carry out the surgeries on. Our second speaker is Dr. Shamudipto De. He is a consultant ENT specialist and right now associated with CNCI Head and Neck Cancer Oncology Department. And Dr. Shamudipto De was previously attached to Jaslok Hospital, Mumbai, and also Deason Hospital in Kolkata, West Bengal, Medical College, Kolkata as well. So, our third speaker is Dr. Reek Banerjee, a pulmonologist and a critical care specialist with more than 8 years of experience. He has been a COVID frontline worker and has been an actively working doctor in the department of COVID. So he has handled infected patients and have been saving hundreds of lives during the viral pandemic. I welcome everybody and I welcome Dr. Dam sir, Dr. Shamodipto De sir, and also Dr. Reek Banerjee. Good evening, sir.
Good evening. Good evening.
Good evening.
Good evening,
So,
Doctor.
sir, good evening, sir.
Good.
So,
Good evening.
to start with, I would like to ask my very first question to Dr. Dam, sir. Sir, as the head of the COVID prevention committee, what steps were initially taken by the institution to ensure the patient services that were not hampered during the pandemic?
Okay. Yeah. Thank you. Thank you for inviting me in this discussion. Yeah. The question is interesting because what did we focus in? Because it was a very new area, and the institute was caught like every other institute in a different situation. We had to focus on staff protection as well as protection of the patients. I think what we focused on would be that there was a definite push towards using the personal protective wear, like the what is called the PPE, its adequate distribution. Then we had to train our staff on the very complicated issue of donning and doffing, which was something new for most of the healthcare workers. And then we also had to focus on quickly identifying patients who would be positive by sampling. So the two issues on which the institute moved forward was the PPE and the nasopharyngeal sampling for RT-PCR.
Uh, all right, sir. So my next question goes to Dr. Shamudipto De, also is associated with the Head and Neck Oncology Department of CNCI Hospital. So, sir, what is the present cancer case load in our country, and how good or bad is the situation right now?
Good evening, Dr. Mona Lisa. Thanks for having me on this panel. The situation is pretty bad. It's not good at all. According to the hospital-based cancer registry and the population-based cancer registry, we have around 13.5 lakh cancer cases in India in 2020 itself, which is a pretty big number, of which the head and neck cancers have the major bulk of around 66.6%. And during this year, because of the pandemic, 30 to 40% of the all these cancers that are, which usually present at a very advanced stage, and they become, inoperable, or they usually are borderline inoperable. They have increased in numbers because they could not get access to the health facilities, as well as we also see that the cancer in women are rising a lot. It has also been predicted that 1 in 9 Indians by 2025 will be affected by cancer, which is a very scary picture. The other cancers which are rising are the breast cancers, the cervical cancers, the lung cancers, as well as the stomach cancers. So the situation is pretty bad. It's and two major causes are there. One is that the unchecked sale of nicotine and tobacco products. There is no specific government regulation that which regulates the sale of such products. And second is there is a basic lack of cancer awareness, which the patients usually the general population doesn't have. There is a very little screening program, screening camps done, and the early, as we say in cancer, early detection and early intervention, which is the best way to treat cancers. It's usually that there is a huge lacuna in that field. Over to you, Dr. Melissa.
Yes, sir. So, as sir has already given us a picture of the present cancer situation, I would like to go to Dr. Reek Banerjee. Good evening, sir. Sir, I would like to ask you regarding what are the comorbidities that render a patient at high risk of getting a COVID infection?
Thank you, Dr. Mona Lisa. COVID-19 is still a new disease, and currently there is limited data and information about what may affect or what may increase your chance of getting a COVID-19. Currently, what we believe is any form of immune suppressing condition like cancer, chronic kidney disease, chronic liver disease, chronic lung disease like COPD, even patients with chronic heart condition like congestive cardiac failure, obese patient, obesity or very severe obesity, smoking, even diabetes mellitus. These increase the risk of your getting a COVID infection. Other than that,
Right.
people who have received transfusions like blood transfusion or even bone marrow transplant recipients, people with chronic compressed conditions like HIV, those who have been on chronically on oral corticosteroids, they also have increased risk of getting COVID-19.
Right, sir. So, as we sir has told us regarding the chances of people who have are more who can be more involved with the COVID-19 situation right now. So, coming to Dham sir one more time, sir, how prepared was the institute to handle the situation in the beginning and of the pandemic? And I would like to hear from you, sir.
Yeah, as Dr. Banerjee just told us, this was a new disease, and the institute was caught like many other hospitals across the world, across the globe. This was a uncharted territory because most of us, average clinicians at least, would not be treating a regular viral pneumonitis or viral disease every day. We were more focused on treating cancer in our institute, and obviously, if there was a pandemic and we had to deal with a pandemic, that required a lot of mental acceptance that we had to go through the different guidelines and different methodology of how to prevent a viral transmission, a new viral transmission about which We had so little information. But what was the advantage with our institute, if I keep the discussion to that, is that ICMR actually quickly gave us one dedicated lab in our second campus. The lab to do the RT-PCR testing. Now, RT-PCR was not widely available in the early days of the pandemic, but it was also the diagnostic lab through which we could uh, detect patients, especially patients with malignancy as well as COVID infection, who would be positive. So, one of the areas which was greatly helpful for us is that we had a dedicated lab in our second campus, and from the ENT head and neck department, as Dr. Shamadipto they will know, there was a huge push to collect samples, sampling from the nasopharyngeal area, which was a dedicated ENT kind of trained area, because initially the health ministry also requested ENT surgeons to come forward for sampling. So our department suddenly was at the forefront of both sampling as well as treating cancer patients. And I think we got a huge support from the government of India, in the sense that they quickly set up a good lab, which gave us necessary diagnostic kits and diagnostic tool. So somehow we lurched forward, and I don't know, long journey ahead. So let us see how we do. Back to you, Mona
Yes.
Lisa.
As sir says, it's a long journey ahead. Since we are talking about cancer related with COVID, so I would like to go to Dr. Shamodipto sir. Sir, how has the pandemic affected the cancer patients and who are undergoing treatment? If you can give us an overview of it.
No, yes. What happened was the Ministry of the of Home Affairs, they established the lockdown procedure because of the pandemic on I guess in the last week of March. And what happened is that because of this pandemic, there was a huge issue of logistics and transport. And we have to understand one thing, that still in India there are the super specialty centers as well as the major maybe the regional cancer centers. They are in the cities, and the rural area there is still a lack of basic health care. So, to understand the consequences of the pandemic, we have to divide it into two major parts. One is the patient factors, the patients who require regular checkup, as in cancer. Cancer requires a very scheduled treatment. It requires regular checkups. It requires, treatments one after the other. And what happened was the patients actually could not turn up on the prescribed dates. And there was also an issue of fear psychosis. There are patients who are non-COVID patients or patients' attendants did not want to come to the hospital because of the simple fact that they were scared of getting infected by COVID-19 itself. Coming to the doctor factors, we have lost a huge number of doctors during this pandemic. A lot of our colleagues have lost their lives. I think more than 400 doctors all over India have succumbed to this disease, and especially doctors who are senior citizens also are at high risk of getting this infected by this virus. So there's a element of fear psychosis among doctors also, who shut down their clinics, and basic diagnostic procedures like laryngoscopies, bronchoscopies, they were all curtailed on. Even we had stopped doing a lot of the long surgeries such as free flap reconstructions. These were stopped, but yes, we did continue our all the health services. We did not stop any kind of patient service. We went on performing our duties, and surgeries also went on, as as much as we could. We could provide for all the patients that attended our hospital. Over to you.
Right, sir. I think sir has given us a proper view of the current situation, how we are dealing with the cancer patients. So, coming to the treatment guidelines, I would come to Dr. Reek Banerjee, sir. So, the treatment guidelines of COVID-19 have been evolving. So, I want to know what are the latest treatment guidelines of COVID-19 now.
Well, uh, before we go into the treatment guidelines, I believe it's very important that we know the classify the patients. Not everybody needs to be treated in a hospital, and when there are people who need any treatment at all. So the disease and its severity has been divided into mild, moderate, and severe. When we started treating COVID at the beginning of the pandemic, we had gone in with almost next to nothing. And thereafter, national guidelines have come up, they have evolved. At present, the treatment guidelines can be divided into, basically the pharmacological therapy and the adjuncts. Pharmacological therapy, well, they have changed. We have seen introduction of antivirals like remdesivir, which have had significant impact. So the pharmacological therapy is still based on dexamethasone in severe patients using dexamethasone and remdesivir in severe cases. In mild cases, who may even be treated in at their home, treatment mainly involves using doxycycline and ivermectin. Earlier on, we were using HCQS. After that, the doxycycline and ivermectin were included. Using HCQS has its own problems. You have to have ECG monitoring, and other than the antiviral remdesivir, in presently in India, there is scope for using a drug called tocilizumab, which is an anti-IL-6 therapy, but it is very restricted use, not used in all patients. Those who are worsening, those who are having a situation called cytokine release syndrome, those who are having their oxygen requirement going up very rapidly, their hypoxia worsening very rapidly. In those cases, we are using tocilizumab. And another very important aspect of COVID treatment, especially in hospital treatment, is anticoagulation, because it's a condition where clots do develop within your body's blood vessels, in blood vessels of your lung. So, anticoagulation has also been very important in treatment of COVID-19. So, at present, we are the present government guidelines. We are using doxycycline, ivermectin in mild diseases, those who have been hospitalized, and when patients require oxygen, uh, dexamethasone is used, and antiviral remdesivir is used, and tocilizumab is used in cases which I mentioned. Other than that, the very important part is oxygen therapy.
Right, sir. So that's a very important thing for the audience to note, what Dr. Reek Banerjee sir just now explained. So, as we are talking about behind the scenes today, I would again go back to Dam sir. So, I would like to ask you one question: is that what were the steps that were taken to ensure the well-being and safety of the healthcare workers in the institute?
Yeah, Mona Lisa, this was, I think, one of the areas of interesting change that took place across all health sector was the focus on saving the healthcare workers, especially the frontline doctors, nurses, and the other staff who handled patients every day. And as I said before, across the country and as well as across the globe, because remember, we came into the pandemic a little late. By that time, Europe had already gone through its huge amount of experience, and we knew that there was a huge role of the protective wear (PPE), in the sense that we had to have N95 masks, we had to have goggles to shield our eyes, we had to have hand sanitizer, as well as using gloves in those cases which required, and in the those cases which required intervention, the healthcare worker would need proper PPE, in the sense that they had to wear the protective gown. So there was a very complicated area, and the institute had to, we what we did is that we had to take multiple classes of different categories, particularly the junior doctors of our institute. then the nursing staff. We had an infection control department, but then no one was prepared for this viral experience. So there was a need for understanding the disease cohesively. So for that we had to take classes, interactive classes rather than a lecture class. It was more of an interactive classes to understand how to use these equipments to save ourselves, especially the staff, in the sense that the compulsory or wearing of masks and proper shield, eyeglasses, and using the hand sanitizer. All these were had to be run through the different categories, including right down to the sweepers and all. Everyone had to be taken into confidence, and that hopefully we were able to do that because more or less we moved as a team and continued the health delivery that was expected of the institute.
Thank you, sir. That's very well explained by sir. As sir himself heads the as himself heads the COVID prevention committee of the institute as well. So coming to Shamodipta there, sir. Sir, how do you screen a cancer patient for COVID before a surgery? What is the institute protocol with that?
So, doctor, we have a very established protocol in the hospital, which is also based on the ICMR guidelines. So, any patient who gets posted for surgery usually gets admitted 5 to 7 days before the OT. And the patient, we have a separate COVID isolation ward, specifically for patients who will be getting admitted and get tested. Now, regarding the testing of the patients, there are a number of tests, antigen testing, CBNAT, TrueNAT. But we still believe that the RT-PCR test is a very valuable tool in the diagnosis of COVID-19. And it has a very high specificity rate of 98 to 100%. So once we have a roster of doctors who go and collect nasopharyngeal swabs, and from patients wearing a full protective PPE gear and all safety all taking care of all safety procedures. And once the report comes, if the report comes as negative, the patient is shifted to the general ward of the general population of patients. But if the patient comes, the report comes as positive, then we have to inform the nodal officer or the local health authorities, and they would be providing ambulance for the transfer of the patient to a COVID hospital. Once the patient has been shifted to the ward, if he's negative, then we regularly check him for vitals. We check his vitals, whether his saturation is normal, his temperature is normal. If there are any symptoms of fever or breathlessness, we immediately shift the patient back to the transit ward and get him tested again. If everything goes okay, then the patient is posted for a surgery. Thank you.
Right, sir. Right, sir. So we have got an overview of how the patients are treated in the COVID times. I would come back to Dr. Reek Banerjee, sir. Sir, since you are actively into treating COVID patients every day, so sir, I would like you to give our viewers an introduction to what is ARDS and how is it a contributing factor to the fatality of the COVID patients.
ARDS is a completely, it's a well, I'd like to make it as much lucid as possible. Acute respiratory distress syndrome, actually it is the very severe form of lung injury which is happening uh, subsequent to COVID pneumonia. It has been there, it has been happening, it can happen due to many causes, but ARDS has been quite common in people who have had severe COVID-19 pneumonia. Uh, to define in medical terms, actually, you can say what you give and what you get. That's how we define ARDS. How much oxygen there is in a person's blood, how much, and that is obtained by giving how much amount of oxygen. Uh, I try to give an analogy. Think of your lung as a big factory, very big shade and all, and there are multiple millions of small rooms inside, and the workers come and they get their job done. This is how the lung functions. There are basic units inside the lung, which we call alveoli. And what happens in ARDS is it's like your entire factory, the rooms inside your factory are getting flooded with fluid. And so the workers can't work and there is no gas exchange taking place. So effectively, the ability of your lung to perform its task, that is to get oxygen in and the carbon dioxide out, is severely impaired. And what happens, say in a flood, when the water recedes, it leaves huge amount of sleet everywhere, and it leaves a trail of destruction. And that is what ARDS is like. Once that flood is over, all your inside your factory, all equipment and everything is covered with sleet, and it's ineffective. You can't use your tools. So that is what ARDS is like. It's a very severe form of lung injury, and which leads patients requiring uh, artificial respiration support, which could be high frequency nasal oxygen, which could be non-invasive ventilation, invasive ventilation, or even extracorporeal oxygen support like ECMO. This is what ARDS is, and it contributes very significantly to the fatality of COVID patients. What we have been seeing is patients requiring oxygen support, those artificial supports like HFNO and uh, non-invasive ventilation support for weeks at a time. And even the few who are getting wind of these supports, they also requiring oxygen therapy for weeks, 6 weeks, 7 weeks. We have had patients requiring oxygen support for very, very long time. And even after they are going home, these ARDS survivors, they are requiring home oxygen for prolonged period. So actually, this is what is leading to the most serious morbidity of COVID-19 pneumonia.
Thank you, sir. I think sir has explained it very nicely how the flood and the factory, the way I think all our viewers can understand and get a view of what ARDS is. So, coming back to Dr. Dam, sir, sir, as an institute which deals with basically the non-COVID cancer patients, how difficult was it to continue the health services, and what has been your experience throughout this COVID pandemic?
Uh, if I take the first part, Dr. Mona Lisa, is that initial days when the pandemic hit the country, it was very difficult because there was a lot of panic factor arising from many unknown uh, uh, parameters, especially as Dr. Rick Banerjee explained, the issue of why patients were falling so rapidly sick and all the analysis and the drugs were not so well available or people did not know the combination. A lot of misinformation also floated, or rather, the different interpretation floated in the social media platforms, which also added to the confusion. So the initial days were very confusing, both from my point of view, in the sense that I had to understand the disease at the same time, continue the health care delivery in a tertiary cancer hospital, which did not deal with the disease. Because, as you rightly said, we were a non COVID hospital, yet we had to remain open, which was difficult because if what to do with a positive patient was an issue. Should a malignant patient be handled within the hospital premises, or should they go to a COVID care or a dedicated COVID treatment center? For that, we had to liaise with the health department, West Bengal Health Department, for some guidance regarding where exactly, and the instruction would be for cancer patients attending public hospitals to go. So the government also took up the challenge and they dedicated the medical college hospital as the referral center for those requiring assistance of treatment for COVID. And those who did not require treatment, would need some amount of care, were referred to the COVID care center in the CNCI second campus, where patients would be kept under observation. So that is what the initial days were very chaotic. And in the long run, we have matured over the days. I think we are understanding, both the patient is also has taken it in their stride, that they have to deal with both the frontiers. And we as healthcare workers, the understanding is that using proper PPE, personal protective wear, and maintaining distance and segregating our patients and staggering our manpower would help in continuing our services. So this is what we are doing. As I said before, I think we are just at the tip of the year, the disease, and we still a long way to go. So every day is a very learning curve for me as much as for the rest of us.
Yes, sir, absolutely. Sir has very well explained, and I think in our tertiary cancer center that CNCI has been to continue its work in between all the pandemic has really been a commendable job, sir. So coming back to Dr. Shamodit today, sir. Sir, my view is, can COVID-19 virus cause any changes in the tumor biology?
Uh, that is a very controversial question, but it's something which also needs to be answered. Uh, what happens is that uh, the cancer is basically a disease which is there is a lack of immunosurveillance. There is the body cannot detect an abnormal cell, and it allows it to proliferate and grow and become malignant. So I came across some papers in the Science Direct article. It's by Ziad Bakuni et al. And it's from the Boston Institute of Medical Oncology. And what they have noted some very interesting facts which show that there is a lot of similarity between how COVID-19 and cancer affects the body. COVID-19, as we know, it once it gets into the body, it can elicit a cytokine storm or a bradykinin storm, and which can lead to a multi-organ failure. Cancer, as I said, also is goes undetected by the body, and there is can grow into something very malignant for the body, and also can cause a lot of if there is distant metastasis of the cancer, it can also cause multi-organ failures. There is another interesting fact that a lot of anti-cancer drugs, like Dr. Rick Banerjee just said, tocilizumab, as well as BTK inhibitors, these drugs actually were made for treating cancer, but they have also been shown to be very effective against COVID-19. Third, very interesting point is that the way the virus gets internalized in the body is through two basic receptors. One is the ACE2 receptors and the transmembrane serine receptors. So the ACE2 receptors are present in the upper respiratory tract, and the serine proteins are present in the prostate. And it has been evidenced that the patients who suffer from lung cancer as well as prostate cancer, in them both these receptors, there's an overexpression. So summing it up, there is no direct evidence that COVID-19 can actually it can alter the course of the disease or make the cancer more aggressive. But yes, we do find a lot of similarities in which both the conditions are affecting the human body. Back to you, Mona Lisa.
Thanks, sir, for addressing the elephant in the room. Now, coming to Dr. Reek Banerjee, sir. Sir, how does a pandemic like this change or affect the caregiver physically as well as mentally?
Well, for one, a caregiver can't run away or can't hide, can't lock his doors and sit inside. So, well, before I address, I don't know, maybe I'll share my own personal experience and those of my colleagues. Uh, this has had a deep impact on both doctors and nurses. To begin with, in the beginning of the pandemic, it was largely uncertainty. You were trying to fight an animal which you don't know how to fight. So the lot of uncertainties and lot of change in working condition, like the PPEs, the sir said, wearing your PPE. PPE, well, everybody knows about PPE, but to wear a PPE properly inside a COVID care unit for hours without the uh, luxury of being able to take it off, without being able to take off your mask to have a drink of water. Uh, those things were new to everybody. hours at a time inside that attire, inside the PPE. And there's simply the rigors of it. Inside, once you are inside that kit, even the relatively simple tasks which everyone did earlier on uh, is quite a bit difficult. It's like an astronaut wearing a spacesuit. Well, it's not so difficult, definitely, but it is. So initially, it was the uncertainty, and thereafter, uh, well, the fear. Fear not only just for oneself, it is for your family. The caregivers do have senior family members and who are more prone to severe COVID diseases. End of the day, you have to go back home. So what I saw, many of my colleagues in the beginning of the pandemic, they preferred staying alone. They preferred staying separated from their family. For one, my father has been staying in a separate apartment from the beginning of the pandemic because I'm there and I'm going to hospital every day. So this has quite a deep impact on your family. And since March that it has started, now what has happened to many of the caregivers is a fatigue, day in, day out, taking care of COVID patients, going about your work. Like you can't imagine what life was like a year back. It's completely different. This is what we are saying, the new normal. The new normal for us, it just seems to kind of go on. It has affected everybody.
Very rightly said, sir. I totally agree to the point that donning and doffing of PPE is like an astronaut wearing a spacesuit, totally. And the fatigue that the caregivers go through is tremendous. So, hats off to you, sir. Coming to Dr. Dam, sir, again, I would like to ask you one question. Is that were there any changes in the care of admitted patients during the pandemic?
Yeah, I think there has been a change in the way we did the pre-treatment protocols, but as such, there was not a major change in the treatment, whether there was radiotherapy or chemotherapy or surgery. Like surgery, initial days, we had to cut down on the long surgeries because we were worried that the patient, in case they are positive or they will not do well. So, as Dr. Shamadipto they said, we were instructed rather not to actively take up those elective surgeries requiring long duration, like free vascular flap and all that, were postponed. Similarly, certain chemotherapy and protocols were also postponed because no one, the doctors were not sure how the malignancy would deal with such intensive therapy. Radiotherapy was blissfully continued for many other diseases, but then the other hiccups that affected was, getting the CT scan done for patients, getting the routine extra chest and blood. All these had to be modified in the sense that there would be a tremendous need of separating the uh, positive patient from the negative. The pre-treatment protocol had to be modified according to the ICMR guidelines as well as the West Bengal health guidelines notifications, so that if someone fitted into the guidelines, we could continue with the treatment. As such, malignancy treatment did not undergo a major change during the COVID time, and thankfully, what I have realized is that most of the hospitals have got back on the normal rhythm of trying to deliver the guideline based treatment for malignancy, which is a separate guideline from the COVID guidelines. We follow the NCCN guidelines. So cancer patients are now getting their area of treatment adequately. Chemotherapy has again come back, and we are having the daycare chemotherapy as well as the intensive induction chemotherapy given to patients before treatment. Most patients are managing their radiotherapy also on OPD basis. They're coming and receiving radiotherapy. And of course, surgical patients, as Dr. Day said, we separate them first, check out that they are not positive, and then take them out for OT. And long OTs have again, surgical treatments have come back. So hopefully, the country can deliver its treatment through different methods as before. Let's hope.
Yes, even we are hoping for the same, and it's a very difficult situation for the country and for the doctors right now. Coming to Dr. Shamodipto Dey, sir. Sir, you have been an active telehealth worker and telehealth medicine into it, and since you have been certified into telemedicine, telehealth as well. So, sir, I would like to ask you a few questions about regarding the telehealth. That what is the role of telehealth amidst a pandemic?
Hello.
Hello, sir, am I audible?
Yeah, I missed the last part
Hello.
of the question, please.
Yes, sir. Actually, I want to know that what is the role of telehealth amidst a pandemic like this? We know that it is very important right now, for as people cannot go to their doctors as a regular visit. So, what has been the role of telehealth in this pandemic situation, sir?
So the COVID-19, what it has done is that it has kickstarted a digital revolution, which was very unwanted. But uh, yes, we do see a huge rise in the number of e-commerce as well as the telemedicine, where the doctors can actually consult the patient remotely. Uh, the concept of telemedicine is not very new. It has been there since 2001. I think the Indian Space Research Organization, they launched satellites into space to provide telemedicine facilities to the rural areas as well as the backward areas of the country. And I think around 400 hospitals are there which have been covered by this network. We have to understand that there is a difference between telehealth and telemedicine. Telemedicine is a very small part of telehealth. Telehealth encompasses everything: physical and mental health, counselors, mental health counselors, as well as alternative therapies, homeopathy, even pranic healing. It encompasses the all the aspects of health, and I think the use of telemedicine at the beginning of the pandemic, we actually could contact a lot of patients who were supposed to come on follow up and who were supposed to come for sequential treatment. We could get in touch with them. So that was a great boon for us, that we actually could help out a lot of patients through telemedicine.
Right, sir. So, as we are talking about telemedicine now, I would come back to Dr. Reek Banerjee, sir. Sir, what difficulty has lockdown caused in non-COVID patients who require their regular health checkup? I am sure there has been a lot of issues of them contacting their workers or going to a doctor regularly. So, what has been the challenge like, and how has the lockdown caused difficulties in it?
So, other than the critical care, I'm part of my hospital's respiratory medicine team. Our experience has been that chronic lung disease patients, they do need do need to see their doctors, and they do need certain supportive care. And the lockdown was very difficult period for them. For once, you couldn't get some regular tests done. You couldn't get the adequate vaccination services, especially chronic lung disease patients in my field who are getting pulmonary rehabilitation. All these services were hugely disrupted. And other than that, even everybody has faced, there are national programs like for tuberculosis and other diseases. So where patients do have to travel to their the respective centers to get their medicine or to remain on follow up, all these things were hugely disrupted in the during the lockdown. And not just that, non-COVID respiratory patients, they often need the pulmonary function tests done. Those tests had to be stopped because of the aerosol generating. You didn't know who was a COVID carrier, who had disease, unless they manifest any symptoms. So all the tests which generated a lot of aerosol uh, had to be stopped, and that was difficult. Suppose I had planned and I had advised tests beforehand, and it's been months that people were able to carry those spirometry tests, lung function tests, AFENO tests. They were just not possible. And now the things are changing. Gradually, these tests have started. But during the lockdown period, it was very difficult. Telemedicine, yes, I would agree with Shomo that this is a thing new for us and we are all getting acquainted with. But to begin with, it was very difficult, at least for me. I myself, I'd like to put my stethoscope on my patient. I'd like to clinically examine them. And with telemedicine, you simply couldn't do it. In the lockdown period, a respiratory medicine patient, patient with chronic lung diseases, yes, I needed to examine them, but that was just not possible. How much information you could gather by seeing a video, but definitely we are all getting used to it. All the those many of the patients now have their pulse oximeter, blood pressure monitoring devices at their homes, so they would tell you their vital signs. They would tell you their baseline oxygen saturation, their blood glucose level they're measuring at home. So COVID has changed. In a way, it has made people more independent. Earlier on, they were completely dependent on these things for doctors' clinic or hospital facilities. But definitely, they are doing it on their own now. The
Truly, sir.
vaccination services which had come to a grinding halt have again started picking up. Uh, Vaccination service is very important. Even though not my field, I think the antenatal care and the care of the infants, those had also suffered.
Right, sir. Truly, absolutely, rightly said, sir. That the times are changing, and we have to adapt to these changes as well. So, coming to my next question to Dam, sir. Sir, has there been any change in the SOP over these last 8 months, since we have now almost have got a better understanding of the infection? Are there any changes that has been done in the SOPs over the past 8 months?
No, the SOPs have more or less remained the same, but I fear that the healthcare worker, as Dr. Reek Banerjee said, the fatigue and everything is making them very lax with the SOP. I mean, we have this tendency to quickly dilute our SOP, and there is a general feeling that maybe the pandemic is going to get over, the vaccine is around the corner, so people are lowering their guard, which is unfortunate for me because we are not in a position to continue taking classes or reminding people over and over again that the pandemic is still very much there, the virus is still very much affecting everyone, and we are not in a position to modify the SOP. 8 months is nothing. As far as my knowledge goes, a pandemic of this proportion will last for years. And we have to be very, very wise that we stick to the SOP that has been framed to protect healthcare worker as well as the patient. If someone is diluting or breaking the SOP, it breaks the entire chain. And this has affected, I think, in the last few months in our department as well as in our institute, we find there is a lack of adherence to wearing a mask or using the hand sanitizer or social distancing or so-called physical distancing protocols. Unfortunately, these are being diluted on an individual basis. But as far as the guidelines, international guidelines, WHO guidelines go, but the ICMR guideline or even the West Bengal Health Notification guidelines, we don't have any dilution of any of the SOPs. So I would say, as an answer to your question, that the SOPs have remained more or less the same. We are not modifying any of the SOP at the moment because the pandemic is very much alive and affecting everyone.
Yes, sir. Very well explained, sir. Now, I would like to go, as since we are talking about the new normal right now, I would like to ask Dr. Shamodipto De, sir, that what can we expect from telemedicine at this current situation, sir?
I'll answer that question, but what just now my head of the department, Damsa, said that letting your guard down, and I'm grateful to what Sir has, because of his SOP and because the care that he has taken of us and that we are still alive. So, coming back to the question, is that what can we expect from telehealth? So, I see a lot of doctors practicing telemedicine from their WhatsApp or from their, the various video interfaces. Now, everything is fine unless you are giving medical advice and there is some monetary transaction involved and the patient takes and the doctor actually charges some fees. Then you have to uh, kind of record the whole conversation, record the whole consultation with you, which the doctor had with the patient, either in a video or an audio or a hard copy. Now, the Ministry of Health, they established these telemedicine health guidelines at as soon as the lockdown began, so that a doctor can remotely medically advise a patient. The patient needs to provide all the information, all the medical history, all the investigations. He cannot hide any information. The doctor sets a date and time for the patient, as well as the whole consultation has to be recorded, as I said, and then a digital prescription is provided to the patient, after which the even the payment is done online. So all this has made health as such a very convenient affair. But definitely, we there is a lot of improvement is required. I think it's going to be the next booming business in the next 5 years. I think Forbes has said that it's an industry of 300 billion by 2025. So let's hope for the best.
Thank you so much, sir, for giving us a proper insight of telehealth and telemedicine. I would like to come back to Dr. Reek Banerjee, sir. Sir, what are the long-term health issues that can be caused by the COVID-19 virus?
For once, we still know very little. Uh, Most commonly, what people are having, those who have had especially severe disease, they're having fatigues, breathlessness, cough, joint pains, chest pains. Many of them have had difficulty concentrating, headaches, body aches, and some have suffered some psychiatric issues like depression, anxiety, mood swings. We are yet to fully realize what are the long-term impact. What we know still for sure is those who have had severe pneumonia, they often have lung abnormalities. Lung fibrosis is definitely a very real thing. So what that causes is it causes impairment of your lung function. It may restrict your ability to perform exercises or strenuous exercises. Um, that is for definitely for sure. We have started all over the world. People have started treating those chronic lung fibrosis with medicines, but it's still not clear how long those treatments should be continued. There is no guideline as such how long that treatment has to be continued or the impact of treatment. It's just been 8 months, so we are still realizing how much. What are the long-term complications? Other than lung, people have had cardiac issues. Post-COVID situation, people have had myocarditis. Some have had kidney injuries. Many people have had difficulties, long-term difficulty with their smell, and some with their taste issues. But the full scope of long-term impact, other than the lung fibrosis, well, we are all still learning.
Yes, so we are still learning, and it's a long-term learning curve that we are currently facing. So I think we are running very short of time. So a few quick questions. I would like to go to Dam, sir. Sir, let's talk about the future of this SARS-CoV virus infection, and how do you think the disease will evolve eventually, and how hospitals should adapt to the SOPs?
Very difficult and interesting question at the end, because I don't know how the disease will evolve, but definitely as we have to evolve. You know, we have to, as human species, in order to be alive and fighting these kind of terrible disease affliction which wipes out large sections of humanity, we have to become wiser. Yeah. I mean, we have to quickly adapt. As Shamadipta said, that the digital platform should will have to be utilized more frequently by the healthcare worker, including the patients. They must understand that uh, the physical appointment or the physical examination would be the last. First, there has to be a methodical way that we can utilize the telehealth portals and access the health system and understand exactly whom to go, where to go, which are the investigations. As Dr. Banerjee said, many things can be done at home, like checking the blood pressure or the blood sugar or even the oxygen level. Maybe in future we can also check our sodium potassium levels at home. All these reports will have to be forwarded before you take up a physical direct contact with the healthcare worker. That would be a one of the evolving areas which all of us will have to adapt to. And the other issue is that we also have to understand that COVID has taught us a lot about the personal protective wear, which we were very, very negligent about. In our country, at least, we considered disease transmission to be happening invisibly, but we did not take proper care. So there has to be a rational distribution and continuation of personal protective wear. As Dr. Banerjee said, it's been a terrible experience for COVID healthcare workers to wear these space suit like equipments or the gadgets that we were forced to wear under the situation. These will have to be rationalized. It has to be more user friendly, more breathable, that we don't sweat inside and become half dead at the end of the day. There should be any fogging. So that requires a lot of R&D, which I think the health sector never bothered about all along. It was more focused on pharmacological products rather than protective wear for healthcare workers and what should be the quality of that wear. That will also be a huge industrial and investment area, I think, the kind of protective wear, as well as how the structure our hospitals would also be different. Like right now, what I was discussing the other day was that we only have HEPA filters or antiviral or viral filters for operative theaters and ITU, but I think that has to change. We will have dedicated wards, rooms with more better air filtration. At the same time, in a tropical country like ours, we have to utilize open spaces for our patients. We cannot have that same structured building by which patients are relegated into narrow corridors. So we should utilize the daylight also as a disease preventing method. These are my some of the feelings, but we have to evolve. That is my most important thing.
Yes, I think sir has very well said that the times are evolving, and so we have to adapt to this evolution as well as the hospital services. Uh, I would like to ask my next question to Dr. Shamodipto there, sir. Sir, are there any pitfalls of telemedicine? If you could elaborate on that.
So everything is good about telemedicine, but there's something very interesting which Dr. Reek Banerjee said, that unless you put a stethoscope on your patient, the examination is never really complete. The doctors, they rely heavily on haptic feedback. They rely on the response from the patient as we examine the patient. The telemedicine is actually a virtual consultation, and it only relies on inspection findings as well as the symptoms and the investigations that the patient provides. It's that experience has to change. One. Second is that there are certain rules that both the doctor and the patient have to be in the same international boundary. That the patient cannot, sit in USA and consult a doctor in India. They have to be in the same country.
Okay.
Third is that the drug regulation. There are a certain number of medicines only that can be prescribed in telemedicine. We cannot just prescribe anything. But the problem is that the digital, in some telehealth consultation sites are providing digital prescriptions which do not require the doctor's signature. That is a medical legal problem that can actually be misused and can be used for taking sedatives or narcotics over the counter. And last, disadvantage also is that the rural areas as well as the backward areas, they still don't have access to smartphones. They still don't have access to good internet connection, which is absolutely mandatory for telehealth or a telemedicine consultation. So yes, all these problems are there, and with time, I guess, the COVID is not looking, to leave very soon, and I think there is time that we can improve on all these pitfalls.
Yes, surely we need to improve on all these pitfalls as COVID-19 is here to stay. It's just been the tip of the iceberg, as already Dr. Adam sir has pointed. Coming to Dr. Reek Banerjee sir, sir, how to take care for a geriatric patient of COVID-19 cases? I'm sure they need a special care as they are old people and they have multiple comorbidities as well. So, how do you take care of the geriatric patients?
Well, geriatric patients, their regular care should continue. They should get their regular medicines, their regular vaccination services. Those who get physiotherapy, that has to continue. Well, that is the easy part. Now, I believe the most important part is when you're talking about geriatric care. Most of the families have elderlies at home. So, the very important thing is for the family members, the able-bodied family members who go out and pursue their jobs, those who are going out for other activities, is to establish a new normal in their own home. First thing is protect yourself because only then you can protect those at home, the geriatric people at home. One has to remember that in general, more people you interact with, the longer you interact with, and the longer there is more people you interact with, your chances of getting a COVID infection is more. So now, for able-bodied people, the impact of infection may be very little, or they may even be asymptomatic. But the geriatric population, they are not. So I believe protecting the geriatric population at home, well, yes, that is very important. You should follow the standard protocols which have been established, and like hand hygiene and wearing mask at public places. Not don't catch infection yourself. And I believe it is also very important that if you are having any uh, common symptoms, like COVID-19 doesn't have any specific symptoms when the disease begins. So if you are having symptoms like a common cold, fever, running nose, body aches, etc., then do not interact. Do not go into close contact with your elderly family members. Wear mask, practice hand hygiene, and get yourself tested. If the geriatric population at home is surrounded by people who are safe, who are doing safe practice, who are sticking to safe practice, then only those people can be prevented from getting infection. Other than that, the usual care, definitely due to lockdown, many services, especially physiotherapy and services which entail interacting with caregivers, has been very difficult. But now things are gradually creeping back to normal. So in that scenario also, it is very important that the caregivers very strictly adhere to the safety protocols. Other than that, nothing much is different. But sticking to the standard practices of safety is very important.
Sure.
Right, sir. Very well explained, sir. That geriatric, I think all of us should take a note that the geriatric people or the old people should be taken care of at home, and a special extra care, a little bit of extra care is definitely required for all of them. So we have a question from one of our audience. This question goes to Ram, sir. Sir, Priyanka D. Bonik, she is asking exactly. People's approach towards pandemic has been changed now. They became very much careless and don't follow any protocols anymore. As the rumors of going around that India is already achieving herd immunity. How far this concept is correct?
I don't know. I don't think it's so easy to develop herd immunity. What the information that I have with this kind of a pandemic is that herd immunity takes a very, very long time. And it would be foolish on the part of all of us if we think that the herd immunity is going to protect us. It's very also unethical in the sense that we expect all of us to get infected and then survive and then develop immunity. It is not going to happen very soon. And in the process of this concept, or as Priyanka Bonik said, that herd protocol, herd immunity is going to save us. It's a wrong thought. This much I can say. Herd immunity will not be easy. It is not there. The best hope would be that we somehow be able to develop a vaccine, and that can give a certain amount of immunity. And for the rest of us, as Dr. Rick Banerjee repeatedly said, we have to understand that the disease can have a mild as well as a very severe form. And for that, we have to remain prepared. And there is the rumor about herd immunity should be kept as a rumor, it shouldn't be trusted. And we have to stick to our protocol, basic protocol of separation, use of mask, and hand sanitization. These would be remaining there to save us. I hope
Yes,
that
I think
answers
Priyanka.
her question. Hmm.
Yes, I think Priyanka has got her answer. It's very well explained, sir. And we are almost going to close our session very soon. So we just want all our viewers as well as our speakers to watch a quick AV after we come back with the last words from our speakers. And so we all are in this together, and we will definitely win this together. So a quick word before ending our session. I'll start with Dr. Ram sir. Sir, we just want to have a closing, a few words from you.
Well, yeah, Mona Lisa, this was very interesting, and you asked very pertinent questions. I don't know about my answers, but I loved listening to Dr. Rick Banerjee's personal experience of handling COVID patients because that gave me a lot of thought. But the only thing that I want to say is that, as in the video pointed out, we have to be in it together and we have to support each other and get it done. As it evolves, we have to be wise that we don't lose our focus and don't become demoralized or over enthusiastic. We have to believe in proper science. That's very important. Human beings have a good scientific understanding of the disease. We must respect that rather than on rumors and thoughts and take necessary steps. That is how we will win the coming day. That's all.
Surely, sir. Let's hope for that. Let's hope for that, sir. Coming to
Yeah.
Dr. Shamadipto De, sir, a quick word from you as well.
I would like to thank Evrox Healthcare for arranging this wonderful discussion. Also, Dr. Mahela Banerjee, lovely hosting. The We still have a lot of questions that are still unanswered, and having a lot of questions more than answers is not a good thing at all. I really hope that the vaccine works and there is mass immunization and it actually provides a long-term immunity. And we all had personal losses. We all had losses on a personal front as well as on a professional front also. We have lost a lot of our colleagues. Uh, so we are in this fight. We will go on fighting, and yes, we shall overcome this as humans can improvise, and we will come out with a cure for this disease.
Definitely, we shall overcome this together. Coming to Dr. Reek Banerjee, sir, a few words from you.
Thank you, Dr. Mona Lisa, and thank you, my co-panelists. Uh, well, should it rather be a take-home message? Well, so what I feel is COVID-19 is a droplet-borne preventable disease. That is the most important part. It is a preventable disease. Please remember that your protective gear is only as good as you use it. If you use it right, you can save yourself and your family and so many more. It is a preventable disease in the end. So let's save ourselves by sticking to all the preventive measures.
Absolutely. So stick to your preventive measures and keep fighting. I think we are going to have a respite from this COVID-19 very soon. It has been an interesting journey these 3 weekends where we got a 360-degree view of COVID-19 and how it has affected us. Starting from, I would like to thank Dr. Kalpana Date, Dr. Manoj Mukherjee, Dr. Kajol Krishna Bonik, Miss Monica Das, Dr. Aniruddha Dam, Dr. Reek Banerjee, and Dr. Shamudipto Dey for making all our 3 episodes a success. And for making this COVID Couch series a success, we have already we are almost close to 4,000 minutes of watching from this first 2 episode, and we hope that this episode will also be well received. So thank you everyone who have watched it. Thank you to the people who asked some great questions and everyone else who has contributed to making this 3 episodes possible and a success. We will come back with many such episodes or shows and hope this helps the people and the masses. And please like the Facebook page as well. And if you have any queries, you can do a comment or message on the number that has been already displayed on the AV to kindly give us any of your feedbacks or suggestions. So I thank all our speakers for today. Thank you so much thank you so much to our viewers for joining us. And I think we have spoken a lot about COVID-19, and we have a better view and an insight of COVID-19 today. And behind the scenes has been a really wonderful episode to speak about the frontline workers, the healthcare workers as well. So thank you all, and have a very good night. Thank you.
Thank
Good
you.
night.
Good night.
Good night, doctor.
Good night.
Good night.
Good night.
Good night.